Morning Show.
All right, y'all. Every Wednesday on the Rick Smiley Morning Show, it's Wellness Wednesday. We got the one and only Dr. Collier is back to help you stay healthy. What up, Dr. Collier?
Good morning, Rickey. Smiley.
Happy to have you, man.
Thank you so much for having me. Good morning, Rocky, Special K, Gary with the T, Alfredus and Debrat, and Rickey. Thank you so much for the opportunity to bring healthcare information to the listeners of the Rickey Smiley Morning Show. So, Rickey, you've heard me talk about cardiovascular disease being the number one cause of death in African Americans. Now, cardiovascular diseases such as heart failure, heart attack, and stroke are the leading causes of death around the world, disproportionately affecting African Americans and people of color. And so we have talked about what we can do to stop that. And there's a recent study that notes a number of modifiable lifestyle factors that can help a person lower their risk for heart disease. Okay, so a new study shows that more than 99% of people who experience a heart attack, heart failure, or a stroke had at least one of these risk factors. The four major risk factors include these disease states: high blood pressure, high cholesterol, diabetes, and smoking. So uncontrolled high blood pressure is the most common issue. About 85% of all cardiovascular disease-related deaths are due to a heart attack and stroke, and about 65 million people around the world are affected by heart failure. Heart attack and strokes, again, continue to be the number one cause of death. There are a number of modifiable lifestyle factors that can help a person lower these risks for heart disease. And 99% of people who experience a heart attack had at least one of them. So these are things that we can control and we can do to expand our life length and a quality of life. We don't want to live a long time and not be healthy. We want to be able to do the things that we can do. So again, high blood pressure, high cholesterol, diabetes, and smoking. And if you smoke, if you don't smoke, don't start. If you do smoke, stop. The incidence of smoking is actually going, after years and years of the rates going down, it's become cool to smoke again, and people are smoking, and so the rates are going up, and so the incidence of heart attacks and strokes are going up, and that's despite the fact that they don't have cigarette commercials on television anymore. They banned them. So it's mostly billboards and printed ads, but they have been smart by putting cigarette smoking into movies. So a lot of the entertainment that you see now, the characters, even if the actor doesn't smoke, they'll have that character smoking. And so that makes smoking look cool. And so people are picking it up again. So there you have it, Rickey.
Oh, man. All right, anybody want to talk to Dr. MJ Collier, you can hit us up at 8669 Rickey. Let's go to the phones. Good morning.
Yes, I was wanting to ask Dr. Collier about proteinuria and how to deal with that to get that out of your urine.
Okay, proteinuria is protein in your urine. Normally, the kidneys are nothing but glorified filters. And protein molecules go through the kidneys. Normally, they are too big to go through the filter. So they just circulate through the kidney, and then they continue in your body's general circulation. Well, what happens when you get kidney damage, there are holes in the filters in the kidney on the cellular level that allows those large protein molecules to come through. So when you see protein in the urine, it is a clear indication that there is kidney damage going on the microscopic level. So chronic kidney disease is a major risk factor for African Americans in particular. It's usually undiagnosed because a lot of doctors don't even collect urines in their office anymore. And so this is a problem. So we need to have it evaluated. The number one disease state associated with that is high blood pressure. So control your blood pressure. The number two is diabetes, so control your blood sugars. Those two things do damage to the kidneys, and the kidneys are one of the organs that have the innate ability to heal and repair itself. So if you catch it before it becomes too bad, the kidneys can fix itself, and the primary treatment is to control those disease states, and then there are a class of medications called angiotensin receptor blockers that report and help the kidneys heal. But also the GLP-1s, the Ozempics, the Mounjaros, they also have been shown to help repair kidney damage.
All right, John, with Dr. Collier, good morning.
I have muscle spasms in my chest, in my back. I was trying to see what's the cause of it. It comes and goes like throughout the year. It's not constant, but when it's constant, it's real sharp pain in my chest and in my back and my neck.
Okay, so those large muscles being affected, that usually means it's something metabolic. The most common thing is a problem with your body's serum magnesium level, but also it can be potassium as well. So you need to get some blood work that can evaluate your body's nutrients to make sure you have enough of the things that you need, like magnesium and vitamin D, to help control those spasms. One of the things that we used to use for muscle spasms is tonic water. Tonic water is available over the counter. They used to have pills that contain that, but they don't have them anymore. So now, just the same tonic water you use for a gin and tonic or a vodka tonic, a big bottle is $1 or $2. Just drink about 6 ounces of that on a daily basis, and that helps with muscle spasms. But you also need some blood work to evaluate that.
All right, you're on with Dr. Collier. Good morning.
Okay, I'm on amlodipine and Benacar, and the amlodipine is causing my heart to pound, a pounding heartbeat, and I wanted to know, is that a side effect, and what can I do about it?
Okay, amlodipine is a calcium channel blocker, and what it normally does is calm down the heartbeat. But as I tell people all the time, it doesn't matter what Dr. Collier says. If it happens to you, it's 100%. So if it's causing you to do that, there are multiple alternatives. In addition to that, you might be suited best to take a beta blocker class drug, which calms down the intensity of the heartbeats, and the Benacar, which is a angiotensin receptor blocker. It works by blocking a hormone that your kidneys secrete that makes your blood pressure go up under stress. So it doesn't bring your blood pressure down. It stops your blood pressure from going up. That's a very important and significant difference, which is why it has minimal or zero side effects unless you're allergic to it. So that's a good combination. Your doctor is on top of what you need. But if you're having that problem with amlodipine, there are multiple other options that you can get to take.
Congratulations to Super Dave on this new commercial. If anybody ever seen that Prevagen commercial with the man out there shooting basketball by himself.
What's going on today?
That's Super Dave, all right.
Dr. Carter, you ever seen that Prevagen commercial with that man be out there shooting basketball by himself? At the end, that's Super Dave. I want everybody to Google the Prevagen commercial for brain memory. Dr. Carter. Is he on?
He's on. Where you at?
I'm on.
There you go.
Dr. Carter.
Yeah.
Have you seen Super Dave in that Prevagen commercial when the man be out there shooting basketball?
I have seen the Prevagen commercial, and I said, well, that looks like Super Dave. I got to give it this shot.
All right, Dr. Collier.
Y'all make sure y'all support Super Dave, man, and all of his great endeavors and the things that he's doing out here, making sure people
branching out. In the healthcare, he's doing healthcare now.
Absolutely, yeah. So check Super Dave out in the Prevagen commercial. We happy to have you, Dr. Collier. All right, let's go to the phone. You're on with Dr. Collier. Good morning.
I have enlarged lymph nodes. I had them biopsied and found out everything was negative. I've had my blood check. Everything was negative. What can you do to shrink those lymph nodes or keep them from coming back?
Okay, lymph nodes are your body's soldiers. They fight infection. And so there are little areas where your army of white blood cells accumulate versus the ones that are just floating around. So as they fight infection, chronic infections, they can get large and inflamed as well. But it's not an abnormal condition, as you noted. It's not cancer. It's not anything like that. So the issue is if there's some underlying infection, like a tooth issue or an ear problem, that needs to be treated. If it isn't, then it's just inflammation, and you need to treat it with anti-inflammatories. And the body's natural anti-inflammatory, vitamin D at 5,000 international units per day, along with something like omega-3 fish oil. Those should be chronic and in your diet continuously, and that will keep that inflammation down.
All right, y'all with Dr. Collier. Good morning.
Good morning. My son is losing his muscle mass in his arms, hands, and shoulder blades. What supplements can he take to rebuild muscle?
Okay, if he's losing in that particular area, that means he's losing nervous innervation. There's something going on with a group of nerves called the brachial plexus that comes out of the neck. There are 5 nerves. They're turned into 3 branches and then 2 branches. So that needs to be evaluated to see if he has like a bulging disc in his neck or cervical stenosis or some problem, because as long as there's no nervous innervation, he's not going to be able to build that up. But because you eloquently described exactly where it's located, it's got to be a problem with the nervous innervation. So that needs to be evaluated and corrected if possible.
Good morning. Go ahead with your question with Dr. M.J. Collier.
I am turning 47, and I just recently found out that I have fibroids, and I just wanted to know what I could do to help minimize it, or should I be concerned?
Depending upon the amount of symptoms that you have, fibroids often result in problems with, they take up space inside your pelvis. So you have problems with your bladder because your bladder can't fill up, so you're having frequent urination. It may go backwards and put pressure on your rectum, so you have difficulty having a bowel movement. You may have pain or discomfort when you have intercourse, but the most common thing is heavy menstrual cycles. So you, instead of bleeding for 5 to 7 days, you bleed for weeks at a time, and the bleeding is excessively heavy, which results in a chronic anemic situation. So there are things that can be done. One of the least invasive is called uterine fibroid embolization, or UFE. That literally corrects the problem without you having to have surgery to remove your uterus. They actually can take out the fibroids by themselves if necessary. That's also a surgical procedure called a myomectomy or hysterectomy. That's the reason that hysterectomy is the number one surgical procedure for women, because fibroids are such a common phenomenon. Now, at age 47, you're approaching menopause. If you can make it and hold on until menopause, fibroids usually shrink after menopause because they don't have hormonal support that keeps them growing. So those are all options that need to be discussed either with your primary care physician or your OBGYN, but there are multiple options for you. But don't wait until it becomes more of a problem than it is, because right now you said you just found out about it, which means the symptoms are minimal, and it can progress relatively rapidly and then become a life-changing thing.
Oh man, that's some real good information. Dr. Collier, let everybody know how you can, and again, we're proud of Super Dave for that Prevention commercial. I was wondering, how did you get your hair like Apollo Creed from Rocky One in the commercial? But don't answer that. But go ahead, Dr. Collier, with your information.
Ricky, I can be reached on all social media at AskDrMJ, Ask Dr. MJ. Subscribe to my YouTube channel. It's at absolutely no cost. And follow me on all social media at Ask Dr. MJ. I'll follow you back. I promise. These are the opinions of Dr. MJ Collier, not those of Rickey Smiley, the Rickey Smiley Morning Show cast, or its production crew. Stick safe. Don't you dare go away. Go to YouTube and see that Prevagen commercial. You'll see Super Dave doing what he does, being super.
With the Apollo Creed haircut.
That's a perfect little afro.
like James Brown on Fox Sports on Sundays.